As you know, October is Breast Cancer Awareness Month, and Southern Cancer Center wants to make sure that you are informed. Today, we are focusing on your genetics and the link to breast cancer. Skylar Martin, who is a nurse practitioner, joins us today on Fox 10. Skylar, thank you for being here.
Thank you for having me.
Yeah, so this is a really important month. We're going to jump right in first with what is a genetic mutation in breast cancer?
Genetic mutations in breast cancer are something that increases a patient's risk of developing breast cancer within their lifetime. And there's quite a few different variables other than the ones that we typically see and hear about on a regular basis.
And so does that mean all of them are considered dangerous?
Not all are considered dangerous, but there are a few that significantly increase the risk of developing breast cancer. So we monitor them all differently.
Someone's watching at home, maybe their aunt, mother, grandmother has had breast cancer in the past. Does that automatically mean that they will have breast cancer? Is it hereditary?
No, not all breast cancers are hereditary. 5 to 10% are what's typically considered hereditary. And so just because you have a family history doesn't mean that you would have the mutation.
And if someone does have a family history or they have a gene mutation, how do they get tested for that?
We do the testing in our office, and it's a pretty easy procedure where we can either do it with a blood stick or blood draw, or we can do it with saliva testing. And the results typically take 7 to 10 days for us to get back.
So what does it mean to be high risk?
High risk is anything that's greater than 20% lifetime risk of developing breast cancer. And the general population has around a 12% risk of developing breast cancer. So when you hit that 20% mark, that's when you're considered high risk.
If someone at home is positive for a gene mutation, does that mean they will develop breast cancer in the future?
No, thankfully it doesn't mean that they'll develop breast cancer in the future. But depending on the gene, we can determine what their risk is, and that can guide us in how we manage and monitor those patients.
And finally, what are options for prevention or to monitor risks of breast cancer?
There are quite a few options out there based on what mutation a patient may have and their risk of developing breast cancer. And those are anything from surgeries, increased screening with mammogram and MRI, and then we even have certain medications that we can use as prevention medicines.
All right, Skylar, well, thank you so much. A lot of information to keep in mind. This is such an important month, but remember this throughout the year. For more information about Southern Cancer Center or about you, where can folks go online?
They can reach out to us at southerncancercenter.com and reach out to me at either of our Baldwin County offices.
And we'll have more information at fox10tv.com.